Okay, welcome back, everyone. Let's talk a little bit about slow oxidative fibers and fast oxidative fibers. So, fast oxidative fibers, these are muscles that contract very quickly, but they also fatigue very quickly. Okay, so I've power lifted for many, many years. So I have a lot of fast fibers, muscles that contract quickly, but also they fatigue quickly. I'm not the type of guy that can run 26-mile marathon by any means or any stretch of the imagination. These muscles contract quickly. I can have strong, very strong contractions. These muscle fibers have few mitochondria. The fact that they have few mitochondria means that they fatigue easily. So muscles that fatigue easily, that contract quickly, this is your power lifter. Fast fibers. Slow fibers, they're slow to contract, they're slow to fatigue, and the reason why they're slow to fatigue is they have a very high oxygen supply, they have lots of mitochondria, so these are like your long distance runner, your marathon runner. These are postural muscles that don't fatigue, whereas fast fibers, these are like your muscles of your eyes. They can move very quickly left and right. You can read, you can follow your eyes can track the words on a book, but we know if you read late at night, your eyes can get tired and helps people fall asleep, right? Fast fibers versus slow fibers. So the white fibers, these fatigue, these are fast fibers, they're pale. And red fibers, these are the slow fibers. They're red because they have a really good blood supply. White muscle, they have a poor blood supply. Red muscle, this is your dark meat. Think about Thanksgiving time. If you're a carnivore and you celebrate Thanksgiving with turkey, you have some people that prefer the white meat and some people prefer the dark meat. Some people that want the dark meat are going to get the leg. Some people that want the white meat are going to get the breast. Okay. Those turkeys aren't flapping their wings flying in the air. They're using their legs. So because they walk around using their legs, those muscles have much more blood and myoglobin going to them. So that's going to have the dark meat. The white meat is going to be the chicken breast, lack of blood, lack of oxygen, they fatigue quickly. The dark meat has more nourishment. The dark meat has more cholesterol, it has more of the B vitamins, it's going to be more nourishing. Okay. Humans have a combination of both, so sometimes they appear to be pink, the balance between both. So the eye has fast fibers and they easily fatigue. The slow fibers, they're a little bit darker. They fatigue, they're fatigue resistant. So your calf muscles, you could stand for hours at a time. These postural muscles do not fatigue very easily. Okay. Now, when you're exercising, your muscles can grow. They increase in diameter, they increase in number, you increase the numbers of mitochondria. When muscles increase in size, we call it muscle hypertrophy. When muscles waste away, we call it muscle atrophy. That's due to lack of movement, lack of exercise. When you exercise or you go from being a couch potato to moving again and exercising, your muscles can increase the number of mitochondria. It's called mitochondrial biogenesis. Sometimes the toughest part is just getting to the gym, and once you're there, you feel great because you're producing more mitochondria, you have more energy. And when you're a couch potato, you have less energy, you never produce more mitochondria, and it's just more fatiguing. So, a few other facts about muscles and age. Between the ages of 30 and 50 years of age, about 10% of muscle tissue is replaced by fibrous connective tissue. And then between the age of 50 and 80 years of age, another 40% of the muscle tissue is replaced. And what are the consequences of that? Muscle strength and flexibility start to decrease, and reflexes slow down. but the slow oxidative fiber numbers, they start to increase. One of the things I look for in my patients when I do my nutritional physical exam or exam in general, I shake their hand, I feel their hand strength, and I turn their hands around. I look at the nails to analyze their nail color, their shape, but I also look in between the metacarpals and I look for wasting of the small muscles of the hand. That means that they're in a condition called sarcopenia. Remember the sarcomere. Sarcopenia is now they're starting to digest their own body proteins for fuel. Either they're not consuming enough protein or they are putting in enough protein, but their stomach lining, the lining of the stomach, is not producing enough digestive enzymes to break down the protein that they're consuming. Okay. Or they're using antacids, right? If they use antacids, then they also block the stomach acids from breaking down protein. So you have to really be thorough. One of the things I look for, I have a dynamometer in my office that looks at hand strength, and when they squeeze it, this needle moves up, and then when they release, the needle holds that position of the strength of their grip. Okay, so I always like to make sure that their hand grip is strong, and I also make sure that their quadricep strength is strong. I analyze my patients and I watch them in the waiting room standing up from the seat. Now, if they can stand up by themselves, fantastic. But you'd be surprised as to how many people have to push off the armrests because their quadricep strength is weak. I want to make sure that they can stand up without using their hands on the hand rests to push themselves up or to use their hands on their legs to push themselves up, right? That's going to require good quadricep strength. We want people as they age to be able to sit on a toilet and be able to stand up and get off a toilet without help. Quadricep strength is very important for that. I also have them walk about 10 steps, stop, turn around, and I want to make sure that they can turn around smoothly without taking 10 to 15 steps to turn around because their balance is off. And again, quadricep strength is really important for balance.